Dear students, in this module, we'll begin with Chapter 4 Reproductive Health. What is reproductive health? According to WHO, health is the state of physical, mental, and social well being of an individual and just not mere the absence of a disease. That means if a person is fit, he has to be fit physically, mentally, and socially. Now, the reproductive health problems and what are the strategies that need to be adopted. India initiated the reproductive health program that is family planning program in 1951. The reproductive and child health care programs have also been working at wider levels. Talking about the programs, what do these programs basically deal with? They generate awareness among the masses related to reproductive aspects. So the masses are given the knowledge. Education is imparted to people about birth control, care of pregnant mothers, postnatal care of mother, child, importance of breastfeeding, which contains many immunoglobulin like IgA and colostrum, to provide equal opportunities for male and female. Awareness of problems due to population explosion, which could result in unemployment, deficiency of food, clothing, and shelter. Sex education is imparted in the school. It's made an important part of the curriculum, the aims and the need of sex education in school so as to avoid sex related myths and misconception, so as to provide right information about sex related aspects and to give proper information about adolescents' reproductive organs so as to prevent the incidence of sexually transmitted diseases, that is AIDS, syphilis, gonorrhea, to name a few. And therefore, there is a need to impart sex education in school so as to generate awareness among the young growing minds. Talking about population explosion and birth control. Population explosion and birth control. In 1900, the world population was 2 billion. In 2000, it shooted up to 6 billion. There was a magnanimous increase in the world population. In India, during independence, it was 350 million. In 2000 of May, it was 1 billion. It is very important to note that every sixth person in the world is an Indian. According to the 2001 census, our population growth rate was 1.7%. That is 17 per thousand in a year. So the population of our country was exploding. Therefore, there is a necessity to control the population so as to make the necessary availabilities to each and every individual of the country. Reasons for population explosion could be betterment of living standards and availability of hygienic health facilities, rapid decline in death rate, the maternal mortality rate, and the infant mortality rate. Increase in the number of people in the reproductive age, which can bear large number of offsprings, thus leading to increment in the population. Now, the impacts of population explosion include the scarcity of basic requirements, which is a right of every individual, that is, food, shelter, and clothing. Therefore, there is a need to control the ever growing population. The control measures include motivation of smaller families, to make people aware about the slogan Hum Do Hamare Do and one child policy or one child norm. In these manners, the control measures could be carried out. The increase in a raise in the marriageable age of females and males, of females to 18 years and males to 21 years, so as to control the ever increasing population. The contraceptive methods which can be adopted. The first property of an ideal contraceptive, which includes it should be user friendly, easily available, it should have minimum side effects, should be effective, reversible so that whenever the couple wants they can have their children, should not interfere with any sexual activity. So these are the properties of a contraceptive which is useful. Now, the various contraceptive methods include the natural or the traditional methods, the barrier methods, intrauterine devices, oral contraceptives could be used to prevent pregnancy, the injectables and surgical methods, that is sterilization, could be adopted so as to prevent unwanted pregnancies. The contraceptive methods, that is the first, natural or the traditional methods, so as to avoid the chances of ovum and sperm mating. That can be done by periodic abstinence, coitus interruptus, or lactational amenorrhea. Now, the 28 days cycle includes the fertile, infertile, and the menstrual days. So, the copulation could be prevented, the coitus could be prevented during the fertile day, which is from day 1 to day 17th in the mid of that is the 14th day of the 28-day cycle, the ovulation takes place. Withdrawal of penis from the vagina before ejaculation so as to prevent the landing of the sperm onto the female body is one method. Lactational amenorrhea, it is that during the pregnancy, when the female are breastfeeding the child for an average of 6 months, they do not undergo menstruation. So these could be the traditional methods so as to prevent the pregnancy, but then they do not guarantee, or they are not the short method to so as to prevent pregnancy. The other contraceptive methods include the barrier methods, which includes the physical meeting, the prevention of physical meeting of sperm and ovum by usage of diaphragms, cervical caps, and walls could be used so as to prevent the landing of the sperm onto the body of the female, so that the penis gets covered and the sperm release can be prevented. These were some methods of contraception. Hopefully, you must have understood them thoroughly. Thank you.